Hello po, and it's a Thursday. Thanks for joining us. I'm Dr. Ana York Bondok, and our program po is called Libreng Konsulta. So, yung mga natatakot pumunta sa doktor at yung mga gusto magpalibre sa doktor, dito na kayo. Okay? Since all of us want to have a free consult, it's here. Okay? I'm an internist, a pulmonary specialist, a congresswoman, a mom, and the wife po of Mayor Jay. And our episode for today is called Ask Dr. Ana. Ito po yung first for the year. So siguro we should put Ask Dr. Ana year 2021 episode number 1, di ba? So please put your questions down below, COVID or non-COVID. We'll be glad to answer them. And gawan po natin ang paraan lahat po ng mga tanong natin for the year 2021. Matagal na po kaming hindi nagkaroon ng free-for-all questions. So here it is. Okay, please follow us on YouTube. We'll be giving prizes po doon sa mga nag-subscribe. We are trying to reach 1,000. It's called Dr. Ana York Bondok. So follow us po on YouTube and we'll be happy po na makasama po kayo doon. Okay? So what should we do? How do we do this? Let's start and ask the questions. Okay, guys? So, ano kaya? Bumati muna. Question number 1. Kumusta, Miss Reina? And Happy New Year to the rest of everyone na ngayon lang po nag-tune in for 2021.
Okay, let's just wait. Parang ano pa lang po yung questions.
Okay. Go. Parang may nakita po akong tanong na.
Yeah. Can you please flash the questions po?
Ayan. Bumati muna tayo.
From Miss Rosana Reyes, hello, Doctora.
Roxana, how are you and Happy New Year?
From Miss Menchi Liscabo Belling, Happy New Year po, Doctora Bondok.
Menchi, how are you? It's a pleasure to greet you and to be with you today.
Ayan na, ngayon lang pumapasok, medyo na lag yata ang internet connection.
Oo, ganyan talaga internet. My gosh. Wala bang dun sa ating post? Walang mga nagtanong din doon?
Here, Doctora, from Miss Kathleen Franco. Doctora, please comment on Filipino naging positive sa UK variant in Hong Kong.
Oh my gosh. Oh, yes. Sandali. Tinitingnan ko nga yung tanong na yon. Thanks for that. Over the last few days, in fact, I was interviewed yesterday sa DZAS radio program about this issue. And i-clarify ko lang for those who don't know the details. Noong December 22 daw po, pumasok itong Filipino na ito. And it took them some time po to genetically sequence the virus. It takes daw 2 weeks eh. So lumabas lang po that this Filipino had the UK variant. So, balikan natin, what's the UK variant and why is there panic over the UK variant? Well, sa UK variant po, this is a mutation or parang nag-iba ho ng konti in the way the virus replicates. Kasi po, the virus replicates rapidly, ano? Sa pagka-replicate po niya, what's the meaning of replicate? Parang a virus can make another virus. Ganon. It becomes more and more, opo. So, as it was producing new viruses po, there was a change in the genetic code of the virus. And ito po, that's what we call a mutation. So, ito pong si mutation ngayon, pinag-aralan na po, and it was first found in the United Kingdom, kaya nga po UK mutation or UK variant. Ano po siya? It was found to be more transmissible. What's the meaning of transmissible? Mas nakakahawa, okay? Kumbaga, dati po, kung nakakahawa po ng isa, ngayon, because of that virus, nakakahawa na po ng 3 tao. So, mas nakakahawa. But the second thing that's good naman po is, hindi naman ho, mas nakakamatay. So, 1 to 2% pa rin ho ang ating pong death rate. But the big issue ho talaga, 55,000 a day na ang nagiging positive sa UK. So talaga pong it's spreading like you cannot believe. And even though the death rate po, it remains 1 to 2%, well, the death rate of 100 persons po is 1 to 2%, ano? That's 1 or 2 persons. The death po of 1,000, 1% of 1,000 is definitely bigger than 1 to 2. And the death rate of 1 million, ang laki-laki na po noon. 1% of 1 million is 1% po of 1 million and 1% of 100 million. Kumbaga, the more lumalaki po yung number na nagkakasakit, obviously, mas marami kasi 20% po ang ma-hospital eh. So, 20% po, the 20% of a very big number, lumalaki. So, yun ho yung problem eh, kasi as the number of people become positive, the number of deaths will increase and the number of hospitalizations po will increase. So, what happened po dito sa UK variant na to, kumalat na po around the world. And the Philippines actually closed our borders to the UK. But as we are now finding out, it's all over the world na po. And ito pong travelers sa Philippines, coming from the Philippines, going to Hong Kong, nandito na rin po sa Pilipinas. But don't panic, kasi number one, we need to know the details. Sino ba itong taon to? Parang hindi pa lumalabas. I have not seen it in the news. I don't know if you've seen it. Reyna, meron na ba? Who is this person? Second, saan nanggaling itong person na to? Did she just come from the UK or was here in the Philippines for a very long time? Yun po. Yun natin alam eh. Thirdly, they said it's a Filipino, but again, I'd like to know the nationality at saka yung history. So basically, kailangan ho natin i-contact trace po itong taon tong who went to Hong Kong. Okay, and then that's the only time po that we can talk about the UK variant being in the Philippines. So ang tanong, marami nagtanong sa akin, Doktora, does this mean that the UK variant is in the Philippines and what do you think? Ako po, I really do think it's possible po na nandito na po siya sa Pilipinas and accurate po yung naging po sa Hong Kong. Why? Kasi po, we only closed the border December 24. December 22 pa ko pumunta yung tao sa Hong Kong. So before we even closed the travel, ang dami hong mga Pilipino were entering during the Christmas season. Number 2 po, aside from the Filipinos entering during the Christmas season, hindi po natin finalo yung 14-day quarantine. After a person tests negative po sa airport, that person is supposed to quarantine at home. Actually, ideally po in a government facility or at home, or at least matrack po na LGU. Ang nangyari po, we lost coordination po between the LGU and the airport. So the people were just leaving the airport with a negative swab. Pero hindi po natin alam what will happen in the 14 days. Kasi we know naman po that the swab is only positive from day 5 onwards. And tanong ko sa iyo, halimbawa, you were riding the PAL plane home or whatever plane po, no? And then may nakatabi kang tiga UK. O, then kumain kayo sabay, no? And then nahawaan ka. Oh. And then you were swabbed here in Manila. O let's say change plane kayo sa Hong Kong, si UK traveler went to Hong Kong, ikaw umuwi ka ng Manila. Dala mo na ho yung COVID na yun eh. So that will turn out negative in the swab because the swab test is only positive upon day 5. Day 1 ka nahawaan yung katabi mo, di ba? Oh. So by the time po you start coughing, the time that you have symptoms na po, which is day 5, wala ka na ho dun sa quarantine hotel. Umalis ka na dun sa quarantine hotel day 2. So, between day 3, day 4, day 5, nalilagnat ka, nagkalat ka na po. So, really, is it possible that the COVID, the UK variant is here? It is highly possible. And I would tend to believe po, no? Pero, ito lang sasabihin ko, no? The transmissibility po of a virus depends on 2 things. Number 1 is the transmissibility factor or yung tinatawag po nating R factor. Sa measles nga po, the R factor is 15. Sa COVID po, the R factor is 3. But if we take precautions, the R factor will become 1. The UK variant daw, 1.5 daw yung R factor or the transmissibility. So what does this mean? It means po that whether kakalat depends on the transmissibility or the UK variant, but there's a second way po that malalaman po natin kung kakalat, and that is human behavior. Okay? Kasi kahit po nagkakalat yung UK variant dyan sa labas, nandun ka sa loob ng bahay mo, maaabutan ka ba? Kung talagang masipag ka mag-mask, you really wash your hands, you are socially distanced, ganun po. Whatever variant cannot enter kasi talagang mag-isa ka lang. You are not encountering persons. So talagang it's a combination of 2 things. The virus and the way it mutates and transmissibility o paano nakakahawa. And number 2 is the human behavior. Okay? Kasi kung hindi naman masyadong nakakahawa, pero talagang sinaksak mo yung mukha mo dun sa mga tao pong may COVID, you did not wear a mask, you were not socially distanced, nakipag-inuman ka, even though mahirap mahawaan, mahahawaan ka. Okay? So, human behavior plays a big role in how a virus or a pandemic will progress. Unfortunately, hindi ko naman sinisiraan yung UK, ano? But still, we see pictures of people going out without mask. Sa US po, talagang matigas ang ulo nila, pasaway, ano po. The human behavior there, talagang may magkakahawaan. And you put it po with the transmissibility of the virus, talaga pong kakalat po yon. Ngayon sa Pilipinas, even if the virus is here, but we're taking care of ourselves properly, we're wearing masks, we're staying in our house, hindi po tayo pakalat-kalat sa daan, we will be able to be okay. And why should the Philippines be more careful rather than UK and US? It depends po on what we call our health infrastructure. What is the meaning po of health infrastructure? It means po, answer the following questions. Ilan ba hospital ng Pilipinas? Number 2, ilan ba ICU ng Pilipinas? Number 3, ilan ba ventilator ng Pilipinas? And number 4, sino hong magbabayad ng mga sakit? In the UK and the US, they have what we call government insurance and private insurance. Dito po sa Pilipinas, we only have PhilHealth at mahirap pa nga po si PhilHealth, maraming problema. So what I'm trying to say is, the other first world countries might be able to survive po this 55,000 persons a day, but honestly, pati ho sila nahihirapan na rin. So the Philippines po, at 2,000 per day, malaki na po sa atin yon. Noong April, it was 4,000 per day. Hirap na po yung mga ER natin. So tayo po, it is our duty to make sure that even if the variant is here, we need to be even more strict. We need to be even more careful kasi kung talaga pong tumaas ang rates natin, we will not be able to survive this because of our health infrastructure, persons, gamit, hospitals, and also the payment system, which is not po as developed and as mature po than the first world. Okay? So, if the UK variant is here in the Philippines, we need to contact trace this person, yung pumunta ho sa Hong Kong, kung talaga siya pumunta, at kausapin po natin yung mga tao. Kung talaga pong nandito na po, hindi rin ako magugulat. And what to do about it, even become more careful. Okay? So yun lang po. That's what I could say about the UK variant and the being in Hong Kong and coming here. Okay?
From Miss Wyatt Esteban, hindi po ba talaga safe ang copper mask?
Ma'am, ito po yung nabasa ko kasi my husband wears a copper mask. So, I posted something and I wanted to investigate po the copper mask. And I asked Dr. Benjamin Ko, who is one of the foremost epidemiologists po ng Pilipinas yesterday. May butas po daw talaga si copper mask sa baba. I don't know, Reina, do you wear a copper mask? I haven't seen it. It's sa husband ko eh.
Yeah, there's
butas po talaga sa baba.
Yeah.
So, any mask with a exhalation valve or may butas, ano talaga lalabas at lalabas talaga yung ano doon. Lalabas yung, alimbawa yung tao may sakit, it will not protect another person. And also po yung yung filtering, kung talagang butas ho yun, the filtering is not that good. Baka may pumasok din sa inyo. So, ako po, I'm going to look at Dr. J's copper mask actually. I told him yesterday I was just leaving the province. Marami pong doktor na nag-comment po kay Dr. Benjamin Ko that if a person arrives in their clinic wearing a copper mask, they will require that person to put on a surgical mask and then to put on the copper mask. So a lot of doctors po are considering the copper mask to be not a protective, not enough protection.
I see. Well,
kasi nagpapagenta ko pa nga yung copper mask ng asawa ko eh. And I was telling him that he needs to wear a surgical mask.
On the chin, that's the same reason why you can breathe easily with the copper mask. And I'm not sure kasi kasi lahat naman ng mask sa akin fit loosely because I have a very, very tiny small face, no? So, yung copper mask, in terms naman sa mga pamangkin ko, it fits snugly on them. So, yung
butas daw siya sa chin talaga. Yun yung sinabi sa akin.
On the chin. Oo, there is really talaga a butas on the chin. And also on the
maybe that's what makes it so comfortable kasi you're breathing from that but you're not really protected, ha? Mag-ingat lang.
Yeah. So yon. And then there's filter, but the filter has also butas. The filter has also butas on the on the chin area. So the filter actually is the same size or same cut or same shape. It follows the shape of the main copper mask. Ganon siya.
Ito lang ang sasabihin ko, you might ask me, Doktora, bakit po yung mga surgical mask, may mga butas din. And that's the principle of layering, Reina. The butas in the surgical mask, halimbawa nakaganito, si layer 1, si layer 2 nakaganon, tapos si layer 3 nakaganyan. So, parang gumaganyan siya, ganon. So, parang natatrap in between, first of all, there's not one straight hole, natatrap siya, and there's an ionic, there's a charge sa particles as they pass through the layers na natatrap sila in between the layers. Yun yung good thing about surgical mask. There are layers talaga, and the layers are not exactly, hindi sila ganito nakaganon sila So, nakuha mo, para siyang netting, multiple nettings, kumbaga. And as the particles move through the netting, there is a charge and they tend to get stuck. So yun yung principle nung surgical mask. And if you notice also the cloth mask, they want multiple layer din si cloth mask, hindi lang isa.
Yeah.
Parang gano'n. At saka gusto rin nila, ang suggestion po nila is that the cloth mask, it should not be shiny kasi pag shiny daw, madali lang dumaan yung pagka madulas niya. So, mas gusto nila may fabric, may talaga, may weight ng konti yung fabric. Yon. So, the Makati Med is already banning copper mask. So, actually, I'm going to look into the copper mask po ng asawa ko. Kung may butas talaga, it's not good.
Yeah, there's butas talaga.
Ay, naku, kung may butas po talaga, not good. Yeah, not
Well,
good.
Doctora, I just have to comment on the surgical mask. I remember kasi when I was a nurse practicing my duty before.
Profession. Oo.
I remember wearing my mask kasi minsan 16 hours ako sa OR I've been assigned on a OR.
Ganun talaga yung mga OR nurse.
Yeah, you cannot leave the patient and endorse it to another sa second round na magpapalit sa'yo. No. You have to finish the OR procedure of one
kailangan.
individual.
Magagalit si surgeon.
Yes, magagalit si surgeon pag may labas-pasok. Okay, I remember wearing surgical mask before. But it's not as hard as it was ngayon. Yung mga surgical mask before, I can attest kahit 24 hours ko yung suot-suot, hindi ako nahihirapang huminga. But nowadays, the surgical mask, nakakaubo na, nakaka-atching pa. And there's something, I'm not so sure kung same pa rin yung gawa before.
Bakit may feeling, Reina? Can I give you a clue kung bakit?
I don't know. Maybe you can tell me, Doktora, please.
And you're not alone, Huwag kang magdamdam. Lahat tayo tumatanda. Yung nakakayanan natin ng bata tayo, hindi na natin kaya ngayon.
Okay. Sige, magandang
yan. Okay, wag na tayo magsabihan ng edad kasi talaga matitigil.
Pero magandang point yan.
Pero basically, yes, it's actually true that maybe, and then of course, ito lang most of the ORs kasi, ito, I'll give you one, okay? Isa-isahin natin yung mga reasons kung bakit when you were a student nurse, it was okay to wear a surgical mask or a young nurse. First of all, age. As we get older talaga, our lungs are not the way they were, okay? That's the true fact of it. Number 2, where were you wearing the mask? Okay, you were in the OR. In the OR, first of all, environment. May aircon sa OR. Malakas ang aircon sa OR because talagang people need to be. In fact, I remember the PGH ORs as being extremely cold that night. Kasi konti lang yung mga tao in the morning, malakas yung kasi nakabalot tayo, when we do ORs, we wear the surgical gown, the scrub suit, then we wear a surgical gown, and then nakabalot pa yung mukha natin. So I wear actually balot na balot yung mga surgeons. So it is quite cold in the OR, and even if you're in a mask, parang masarap pa nga mag-mask kasi parang na warm ka. Okay, and then number 3, ano talaga when you're a surgeon, you're highly motivated or you're an OR nurse, you are saving someone's life. Nandun yung motivation talaga nandun. And then there's also fear na mumurahin ka ng surgeon or ng head nurse ng OR, usually a very mataray person. So, I'm sorry sa mga head nurses ng OR, but honestly, kailangan naman ho ng disiplina sa OR, di ba? Nobody can take off their mask. Kahit ano pang mangyari, palalayasin ka dun sa OR na yon kasi lalo na sa PGH where I was trained or in the States, talagang yung sterility talaga ang malaking issue. Okay, contrast it to now, today. Okay, number 1, mas may edad na tayo. Number 2, where are we wearing the mask? Ngayon, dati nasa loob lang tayo ng ospital with a aircon. Ngayon, you just go out, you have to get the Grab, you have to go to the palengke. These are not comfortable places. Wala na ngang mask, ang hirap na. Mainit pa. So, can you imagine having to put a mask? And then ngayon, may face shield pa. So, the whole thing is just terrible. And then number 4, may kapaguran din kasi 'di ba? In the OR, when you leave the OR, relax ka na, ano ka na, Eh ngayon parang wala, you have to keep wearing the mask the whole time. It's just really tiring. So yun lang, Reina. I don't think something changed with the mask. I think we got older. And number 2, yung motivations. I mean, parang iba Dati talaga, we're saving someone's life. Ngayon, parang it's just so tiring na talaga. And I really, really, really understand everyone's parang kapaguran. Kaya lang we need to do this. Baka naman UK variant dun sa kabilang street nyo. Naku, please wear a mask, guys. Advice ko sa mga tao, magdala kayo ng electric fan, bugahan nyo yung mukha nyo palabas para yung air from your face outwards. And then, paypay din po, paypay. Okay? Kasi again, remember, ventilation is important. Okay?
Yeah.
So, I didn't attribute it all to age, okay? So, relax lang.
Yeah. At saka kasi, di ba, Doktor, ang mga surgical mask, they are really meant for you to cover, protect you, but plus at the same time, it's scientifically made para makahinga talaga on a longer
naman. Ang dami ng patay na surgeon ngayon.
Yes. So that's it lang. So kung magpipili lang din naman kayo, murang-mura na ang surgical mask ngayon.
Surgical mask per box yun.
Yep. Okay, next.
Okay, next.
From Miss Kathleen Franco, Doktora, kailan po mag-uumpisa vaccines in Philippines? Baka late na po tayo. Ayan.
Nako, Miss Kat, thank you for this, who sent this to Miss Kat. Thank you for this intelligent question. And I think that's everybody's question now is when? When talaga? And what are the plans of the government? Sana sabihin na ng gobyerno yung plans nila para at least we're not kept in the dark. Marami na po talagang hoping and praying. In the US, ito lang sabihin ko the US, the UK, and the EU, nahirapan din silang magbakuna. In fact, the most organized vaccination is in Israel. Talagang magaling naman talaga ng mga Israeli para silang army invasion dun, Talagang magaling sila. So, I hope it will be soon. I can't say, I would say it's not until the beginning of the middle of the year. So, marami pa rin ho tayong tatahakin po. And I would like to say, even if we're already vaccinated, we still need to wear a mask kasi hindi pa rin ho natin alam kung there's a lot still to be learned. Yun po. I would say middle of this year to the end of this year. And I wish that the government would keep us informed na rin po. But again, wala pa rin naman ho major Asian country na nag-ano Opo. And as long as we keep pace with our neighbors, I think we'll be okay.
From another viewer of our YouTube, from via Miss Kat, Doktora, what's an abdominal aneurysm po?
Ay, oo, I'm sorry talaga. This is I think pertaining to the stewardess po na nahanap. And our condolences po to the parents at yung mga nabatayan. This is not towards that person. What is an aneurysm? And yung naano po niya sa kanya is an aortic aneurysm. What is the aorta? The word aortic comes from the word aorta. A-O-R-T-A. Pakilagay lang. A-O-R-T-A. Aorta. That is the main po, daluyan po ng dugo. It comes out of the left side, the left ventricle of our heart. And then you can also put abdominal aortic aneurysm, okay? Where does the aorta start? The aorta starts po from the left ventricle of our heart. It curves po towards, pakorba po siyang pababa. So it will curve and then it's what we call po the arch of the aorta. It goes here eh. And then it gives so the major arteries to the neck and then going down po, no? And then as it goes through your chest, it's called the thoracic aorta. As it goes down po, the same main blood vessel becomes the abdominal aorta. Ito lang po ito po, pag nasaksak kayo dyan or nabaril po kayo into the aorta, all the blood po of the body comes from there. So talaga pong, talagang it will gush out like you cannot believe. Okay? Pero, what I can tell you naman po is, the aorta is very deep po inside our body. Malalim po yan. It's not superficial. So, mahirap po siya talagang maabot. It's not that common, and it's also here, it's protected by the clavicle, by malalim po yan, okay? So it's called the thoracic aorta. Here it's called the abdominal aorta as it goes down, and then it will go into a Y into both our legs, so into forming the femoral arteries, okay? And what's unique about this, I told you the aorta is the main daluyan ng dugo ng ating katawan. It goes to the head, to the thorax or the chest, abdomen, and then down to the legs. It is very well protected po by our internal organs. Malalim po siya. It's not something na, halimbawa, nasugatan ka, oh my God, that's my aorta. Hindi po ganon. Malalim po siya because it needs to be protected. Kung kayo po ay nabaril o nasaksak po doon, it will be very devastating kasi talagang you will die within minutes. Ganun po siya talaga. And OR ho talaga ang kailangan dyan. It's a major vascular surgery. So, what is an aneurysm naman po? An aneurysm naman po is a weakening in the wall of a blood vessel. Okay, whether it be the aorta or any other blood vessel. Parang humihina po, our blood vessels are made of layers. Layers po yan. Pag puputulin po yung blood vessel, o kung kumakain po kayo ng mga litid na mga like if you're eating linagang baka, sometimes, di ba, you see may natitirang lalo na yung mga hihilig sa mga street foods, ganon. Kung minsan may nakikita po tayo, like we eat bulalo. Have you ever eaten bulalo, Reyna? Sometimes you can see the little blood vessels, no? Pag titingnan po nyo po yan, that's elastic. You cut it that way, ganon. Ganyan. Opo, ganyan siya. Layers po yan, okay? Layers of elastic. Ngayon, pag may humina po doon, it can burst, okay? By itself. Yung binanggit ko pong pagsasaksak at saka po pagbabarel, that's an outward force that will burst your aorta. Yung abdominal, an aneurysm naman po is a weakening in the wall of the aorta. And there comes a time po, halimbawa masyado ho talagang mataas ang presyon nyo, ganun po, pwede pong it can burst just by itself. Lalo na po kung mabilis pong, kasi hindi maka-adjust po yung blood vessel nyo. If you suddenly put a huge force, like a super high blood pressure po, pwede pong pumutok yun. Okay. What causes aneurysms? Aneurysms can be po, some people were born with aneurysms. Usually sa brain po, may nakikita po silang mahinang blood vessels sa brain. Kung minsan nagbe-burst lang po yan, it can happen. And people have been known po to just die po from a it's called when the blood goes out from the blood vessels and goes through the layers of the wall of the blood vessel, that is called dissecting. And then pwede po siya talagang mabilis. It's what we call a dissecting aortic aneurysm. It can be very fast and it can be it can just happen. Nobody caused it. So very prominent persons po who died of a burst aneurysm. Si former Congressman Henry Cojuangco, ang bilis po, a burst abdominal aneurysm. Si first gentleman actually, si FG, the husband po of President Gloria Macapagal Arroyo many years ago, I think that was year 2007, kung hindi po ako nagkakamali, Presented with abdominal pain. Kasi abdominal and back pain po na hindi ma-explika, CT scan po kailangan dyan and to check your abdominal aorta. But again, it's kind of rare. Sumakit po, he was in Baguio for, Holy Week. Sumakit po yung tiyan niya. He was actually being treated po as gastritis, yung mga the usual stuff. Bigla pong it was radiating towards the back. So his doctor po said, "Sir, parang just to be sure, let's just do a CT scan." So skinan siya in Baguio. My God, they saw that ang laki pala ng aorta niya. Basically, it was dissecting. The blood was going out po of the abdominal aorta and going na into the wall. Minuto na lang po mamamatay na po yung tao. So he was rushed po to Manila and underwent a major thoracic operation po at binalutan po yung kanyang aorta and he is alive to this day. So it's actually a miracle. So yun po yun. So that's what an aortic aneurysm is. It is a weakening po in the wall of the major blood vessel of the body. And it's usually po in older persons, people po na may high blood, people po na may atherosclerosis. Ano yun? Marami na pong cholesterol ang kanilang katawan. And nasira po ng cholesterol yung kanilang aorta. It happens. It usually happens. Can it happen in young persons? Yes. Can it happen po without anyone doing anything to you? I'm not commenting on the case, but people have died po from abdominal aortic aneurysm na pumutok po biglaan lang. Okay? Another cause po kung bakit pumuputok ang aneurysm, sinabi ko po, sinaksak, binarel, spontaneous rupture po, and number 4 is car accident. Pag bumaon po si steering wheel dito, pwede pong umabot ho hanggang doon sa, you can actually cause problems po sa inyong aorta. Or vehicular and traumatic accident, halimbawa po na-slice kayo na metal doon. So, thoracic aorta nyo po ang madadali. Okay? So, yun po yun. I hope it's kind of clear. This is not a comment on anyone's case. I don't really know what happened. Hindi po ako ang nag-autopsy noon or was not present. But in case you want to know what's an abdominal aortic aneurysm, yun po yun. Okay? Cure for aneurysm. What's the cure? Number 1, dapat regular po yung blood pressure nyo. Because a high blood pressure po will cause weakening. Kasi mabilis po yung, yung pressure pababa. So talagang yung wall nyo po gumaganon parati sa bawat pintig po ng puso nyo. So sa isang biglaan ganun po pwedeng pumutok yun eh. So if it's growing or as you're getting older po, merong mga iba binabantayan yung aneurysm nila kung lumalaki. Yung iba naman po, ino-opera na dahil talagang malaki na. There's a size kung kailan ho pwede nang operahin eh. What they usually do po is they get a Dacron graft. It's a graft, parang siya eh. It's made by, it's man-made. Babalutan po nila yung aorta nyo para to strengthen po your aorta. Yun po yun. They'll do some sort of grafting and vascular procedure po. Depende po kung ano nangyayari or bypassing, whichever po. It depends po on the vascular surgeon what's the best po. But cure for an aneurysm is usually po an operation. Okay? So, yun.
Doctor, one of our viewers, follow-up question, what to do with a person having ruptured aortic aneurysm? Or yung
itakbo nyo po sa dalhin nyo po sa if, eto lang if someone is presenting na po with abdominal pain and back pain, and then biglang namutla po or you have to rush that person to the diagnostic test po is a CT scan, and then kailangan po immediate surgery. Si FG po tinakbo po from Baguio, tinakbo po talaga sa Manila and diretso po sa OR sa St. Luke's. St. Luke's QC po. They couldn't even go anywhere else. Kailangan pagdating na ng Quezon City, kailangan operahan na ganun katindi.
From Miss Jesusa Lara Rayodica, from Dubai, Happy New Year, Doctora. Which vaccine po is the most effective? Is Pfizer po effective?
Ma'am, ganito po yun. I think most of the vaccines are proving to be quite effective. Even the Sinopharm, or the Chinese nung nabalita na 50%, marami pa rin hong data na lumalabas eh. So I would say po that the vaccines are pretty effective. I cannot say one is more effective than others. Wala naman yung lumalabas na talagang bad effectivity. Um, ang nabasa ko po sa Pfizer, the first dose is already 52%. That the second dose is almost 90%. So these are pretty good numbers po. One of the things that we will have to consider, so sabihin na po natin effective lahat sila, no? Ang pipiliin na lang po natin is number one, the cost. Siyempre po, it has to be affordable. And number two, this is very interesting po, is the handling. Kasi yung Pfizer po, it needs to be very frozen. And ang pagkabasa ko po is after 5 days na tinanggal na po sa freezing, kailangan magamit na po siya. The Moderna, refrigeration. And I think the AstraZeneca is room temp. So, malaking bagay po tayo. Yun eh. We are 7,100 islands, Reina. Okay? Some of our, malalayo, they have to travel by ship, ganun-ganon. Yung ating, talaga cold chain, pag nalabas ho yan sa, sa ref or sa freezer, at medyo naiwanan lang po dyan, kahit isaksak sa inyo, it will not be so effective. So, I think, they are all fairly decently effective, ma'am. Ang kailangan po nating isipin din po is logistics, cost, and number three po yung availability kasi kahit na gustong-gusto po natin si Pfizer, meron pong manufacturing issues talaga yung bawat vaccine. And in the first world country nga po, kulang na kulang pa po talaga. And they are not being able to reach their vaccine targets. So, yun po yun. Over this month, I'll be doing side-by-side comparisons ng mga vaccines. Pero I think, Rina nga, ito sasabihin ko, sa akin lang I'm not an expert, okay? No, well, I am pretty much, I know a lot. What I could say is, baka we won't have the freedom of choice, ma'am. Because of the rarity po nung talagang, halimbawa, frontliner ka, ayaw mong pababakuna, I'm waiting for ganitong brand. Baka we can't do that kasi emergency siya eh. So kung ano yung maging available, baka yun ang mapipilitan natin until talagang marami ng vaccine and then we can pick and choose. Pero right now talaga feeling ko ma'am baka hindi tayo makapili.
From Mr. Henry Olikino, hello po, Doktora Ana. Happy New Year po. As lang po, Doktora Ana. Need po ba every time na lumabas sa bahay like magpunta sa market or groceries like gabi na po? Need po ba na maligo agad? Every time na nakauwi na tayo sa ating bahay. Thanks po, Doktora Ana. Magandang question to, Doktora.
Yeah, that's very, especially for those na medyo older or meron pong ako po, to be very honest with you, I'm leaving the house. I have no choice. Hindi naman ho ako talaga naliligo every time I come back. Siguro po, first of all, surfaces. Hindi na ho ganun ka, Really, wala naman ho talagang, studies have really shown that it's, that it's really, that it's really airborne, droplets, social distancing, ganun po. As long as hindi naman ho kayo nakapag-holding hands sa isang taong may COVID, I think the risk is minimal and kung feeling nyo po mapapasmado rin naman ho kayo, ako honestly, I don't think about every time. Dati, I used to, pero ngayon wala naman ako nakitang hindi naligo na COVID, Ito advice ko sa inyo, sir. And you are wise to be cautious. Wala naman pong masama. If you want to take a bath po with warmer water. Pero at least hindi naman ho kayo na mapasmado. Number two, you can make punas na lang po with alcohol. Wala naman din pong masama doon. I'm okay with that. And then number three, you might want to, my cousin always wears long sleeves when she goes out para yung paghubad po niya ng damit. Yun po yun. Pwede din po yun. Whether it's a requirement to take a bath, I would say hindi. But if you would like to, okay na okay po yun. Kasi lalo na if you're older na, baka mapasma ka naman. So yun.
Yeah,
so magpunas na lang na alcohol, pwede rin. I could say pwede rin.
Yeah, sabi nga ni Doktora, if you can, at least, if it will make you feel safer, then please.
Oh, yeah, do so. Oo.
By all means.
At saka yung kamay nyo naman talagang anuhin nyo ng mabuti. Wala na, okay naman po yun. And if you like, magpainit ka ng tubig. Opo.
From Miss Jasmine Sinahon, hi po, Doktora. Good evening. From Miss Paige Rihanna, hi, Doc Ana. Good evening po sa inyo. Watching here po.
Thanks, Paige.
From Miss Rosalie Manalili, belated happy Three Kings po, Doktor.
Oo nga, the Feast of the Epiphany, yung Holy Three Kings, opo.
From Miss Loida Liandico Diaz, good eve, Doktora. God bless. Have a blessed New Year po.
Kayo po rin, ma'am. Thanks for joining us.
From Mr. Darwin Cruz Magtalas, good afternoon po.
Darwin, good afternoon.
From Miss Jeffrey Kiambao, watching here at Barangay Poblacion, Santo Tomas, Pampanga, with LNB President Joel V. Laison.
Hi, Sir and Sir Joel. How are you rin po? Thank you. Kumusta po yung mga tiga Santo Tomas?
From Miss Loida Liandico Diaz, watching from Arayat, Pampanga.
Hi, Mom. My dad is from Arayat.
From Miss Paige Rihanna, thanks for sharing, Doc Anna. More lesson to learn from you and more tips. God bless always.
Thanks, Mom.
From Miss Jenny Gulapa, hello, Doktora. Watching here at Barangka, Candaba po. Happy New Year po.
Hi, Ma'am Jenny. Kumusta po sa Barangka?
From Miss Gigil Jimenez Magaling.
This is our celebrity guest for today. Attorney and Board of Regents po si former labor attaché, hero po nung Iraq War kasi talagang ang dami niya pong in-evacuate ng mga Filipinos. He's now a member of the UP Board of Regents, Attorney Gigil Jimenez, and my very good friend. Ayan.
From Miss Techi Mangulabnan Lansangan, watching from Milan, Doktora. Again, we are wishing you a blessed 2021. May the light of the star in Bethlehem or Epiphany continue to light this year for our family and to people all over the world. Thank God we celebrate Christmas, New Year traditionally, separately through video call, taking all precautions for the safetyness of all. God bless you always, Doktora. Hugs and kisses from Lansangan and Mangulabnan family.
Ang ganda naman ng pagkasabi ni Ma'am. Kayo rin po, Ma'am. Hugs and kisses. I know that you're in Milan. I like the fact na talagang nag-video calling sila talaga, no? It's called physical distancing. It doesn't really mean social distancing. You might be physically distanced, but you don't have to be emotionally distanced. And yung support po talaga ng friends and family ngayong it really means a lot. It really means a lot po.
From Miss Barbie Taruk Olap, Doktora, ask ko lang po, lagi pong sumasakit yung sikmura ko at sa ilalim po magkabilaan ng tadyang ko. Bakit po kaya, Doktora? Salamat po. God bless.
Ma'am, are you acidic? You might try Maalox. Opo. Lalo na po dito, epigastric ang tawag dito eh. Just below, just where your chest ends and your tummy begins. A lot of people, ma'am, are acidic. How to know that? Try and modify your diet po, no? What is an acidic diet? Avoid coffee, avoid citrus, avoid chocolates, and then try to eat po at least 2 hours before lying down. Marami po talaga, it's called gastric GERD also, yung pabalik po si acid. So, it's very common. And then again, if it's possible, I don't know if it's possible, try to avoid stress. Meron bang ganon? Can we avoid stress? We should.
From Miss Kathy Rodriguez, Doktora Ana, is it really confirmed that having drugs and alcohol in your system can result to aortic aneurysm? Ito yung parang follow-up dun sa natin.
Ito po yun, drugs and alcohol do not cause the aorta is a huge blood vessel. Okay? It's not, taking drugs will not cause your aorta to weaken. Taking alcohol po talaga will not also cause po your aorta to weaken. What can happen? Ito lang, and I don't even know what anyone took. Okay, I'm not judging anybody here. But some people
siguro on a scientific base point.
Yeah, on a scientific basis, and this is not to anyone. Okay, this is just about aortic aneurysm in itself. Ito po certain drugs, and I have seen this. Okay, certain drugs and certain steroids po can really push up somebody's blood pressure. Meron pong mga bata na nakita ko po sa ER, ang tataas po ng presyon. And then dinadala po sila ng mga kaibigan nila. Then we ask them, anong nangyari? Eh, marami hong ininom, we don't really know po. Sometimes a lot of these substances, energy drinks, whatever, steroids, naku Diyos ko, tumataas bigla po yung blood pressure ng isang tao. I have seen this happen, okay? Cocaine, another thing. Yung mataas bigla yung presyon or talagang borderline na po sila, tumaas pa because of what they took, ano po. Ngayon, if a person has a weakened aorta or any weakened blood vessel po, talagang the blood pressure can cause a burst po of a weakened blood vessel. Yun po yung that's the concept of a hypertensive bleed, okay, Rina? That's the concept of a hypertensive bleed. Kaya lang sa utak. It can happen po anywhere eh. Lalo na po yung mabilis po yung pag-akyat ng blood pressure. It's not like 160 ka every day, okay? Hindi po putok yun ng biglaan eh. Pero if you're like 110 or you're like 90 and then you took some drugs, we don't even know what, there's a lot of drugs that we don't know, biglang nag-180 si BP mo, kung meron ka talagang weakness in any blood vessel, it doesn't have to be the aorta. It can be it's very common in the brain, puputok yun. Kasi, it's like hindi siya the blood vessel is elastic. Ngayon, kung everyday, mataas ang presyon mo, makaka-adjust siya ng unti-unti. Okay? Pero halimbawa, ganito yung blood vessel mo, biglang ginanon mo, puputok yun.
The question. So, ang aneurysm, this is my this is my personal question. So, ang aneurysm can be detected, hindi siya yung biglaan na nangyayari. Can be detected siguro mga ilang days or ilang months, ganon?
No, people can just die. Former Congressman Henry Cojuangco, the best friend of my uncle, and this is really sad. Tito Henry is a good friend of mine. He was talking pa with my uncle the night before. They were supposed to eat lunch. Okay, the guy was perfectly okay. Parang not just, medyo lang. My uncle was calling him around lunchtime, hindi na po sumasagot yung tao. Yun na po. He was rushed to the hospital, had a burst aneurysm, and that was it. Ganun lang.
Oh my. So,
yes, an aneurysm can be considered po a time bomb.
Oh no. So parang siya. So what can cause this? Like yun nga, high blood pressure?
It can be, number one, it can be genetic. If you're young, an aneurysm is usually genetic. Yung you were born that way, okay? As you get older, blood pressure, poor control of the BP, atherosclerosis, yung coronary artery disease and the deposits of plaques and cholesterols can weaken the wall po of your blood vessels and cause an aneurysm. So an aneurysm po is a weakening in the wall. Merong aneurysms. Are aneurysms only in blood vessels? No, they actually have weakness po sa left ventricle. Mga ganun po, they can cause other problems din po.
Okay, sorry, I have to ask.
How to detect an aneurysm? Wala po talaga. Wala naman hong screening test talaga eh. Kung persistent headaches na talagang hindi na po ma-explain, sometimes people will do a vascular test called an MRA, angiogram po, to check kung may aneurysm po yung utak niyo.
Doktora, sorry, I have to ask. I really have to ask this. Just to enlighten myself, ha?
Sige.
I'm not referring to anybody's opinion, just myself. So, when you overdose yourself, not particularly on party drugs, okay? Like you overdose yourself, can that cause aneurysm?
Hindi.
Okay.
Will it cause the aneurysm? No. Can it cause increased blood pressure that if you had an aneurysm, biglang pumutok? Possible.
Okay, thank you so much for that, Doktora.
Hindi sa biglang hihina dahil sa ininom mo. Ang nun, mahina na siya. Tapos, yung presyon siguro ng tao, umakyat bigla, and as I said, biglang gumanon, puputok yun.
Thank you so much for clarifying that, Doktora. Thank you. Ako naliwanagan ako kasi akala ko, if you take so much drugs, no, may it be in any form, kahit Tylenol lang yan, no, nag-shoot up ang blood pressure, that one can cause aneurysm. However, if only your aorta or your blood vessels are weakened, so yung aneurysm
hindi naman talaga yung prolonged drug use. Well, actually, prolonged drug use can also like years. can affect your blood vessels. Pero yung biglaan drug use, it's usually due to blood pressure. And then your blood pressure got so high, you have a weakness in your brain, you have a weakness in your aorta, you have a weakness everywhere. Possible na pumutok. Another overdose po for those who are thinking about it, cocaine. Ang dami po namin nakikita dati sa US when I was in the ER din po, mga bata rin, inatake sa puso. Sabi namin, my God, ano ba bata nito? And then, ina-angiogram namin, bukas naman yung puso nila. Like, all the vessels are open. So, hindi namin alam why this person had a heart attack after a cocaine, nagre-recover sila. Inaamin naman nila sa akin, doktora, we took cocaine. We had a party, we took cocaine. And then, nagre-recover sila. Then, in-angiogram namin, bukas lahat ng blood vessel. So, sabi ng mga cardiologist, what happened? Ito po yung nalaman nila. Cocaine naman po can cause, yung vasospasm. What is the meaning of vasospasm? Yung maliliit po na blood vessel, biglang sasara. Or parang magre-react sasara. And that happened pala sa puso. Biglang sumara po yung mga, yung mga blood vessels nila sa puso, and that caused a heart attack. So basically, a heart attack from an older person is due to build-up po ng plaque and cholesterols and fats. Alam na po natin yun. Then biglang babara. Diba? Sinabi nila barado. Yun. That is the heart attack of an older person. The heart attack po of a younger person who took cocaine, talagang biglang nag-vasospasm pala. Tapos, nawala ng dugo, parang namatay yung puso, a portion of the puso. And then later on, pagtingin namin, pumapasok naman lahat ng dugo. Ano nangyari? Walang bara. Yung pala, it was a momentary spasm. But that momentary spasm already caused lack of blood sa puso, and that caused a heart attack. Yun.
Ang galing. Appreciate.
People don't know that.
No, I appreciated it more, Doktora. Salamat sa pag-explain. Salamat. Kasi from this medical standpoint, you will identify ano ba talaga yung cause, and you will identify to yourself, huwag na pala ako mag-take ng ganito, or hindi na pala ako dapat mag-party. Diba?
And then, ito lang this is very scary to parents of younger persons. Nung unang panahon talaga, alam natin kung anong ininom ng mga tao, like for example, heroin, and then for example, cocaine or whatever. Sa po ngayon, because of the modern, na po ng mga drugs, we don't know sometimes kung ano na talaga yung nandun. Kasi a lot of them are now, shabu kasi is something that is, talagang, manufactured in a lab na yan eh. So, ang dami na po mga yes, the term is synthetic drugs. Synthetic drugs. We don't know po what's in the synthetic drugs. Kami bilang doktor, we are blind. We do not know. Marami po dyan, mga steroids, kung ano-ano na po, na nag-aalo na po. And, dati, merong mga antidote, kung heroin, ganyan, kung morphine, ganito, kung cocaine, ganon. Kung hindi na talaga namin alam, ano yung bibigay namin?
Salamat, Dok. Salamat sa
nakakatakot talaga. Don't you remember, there was this concert, and this is so sad, may mga bata, they were like eating like this candy, I'm sorry kung nagkamali, but I remember it was a close-up concert. Baka murahin ako ng close-up. Pero five kids or 5 teenagers died from eating this candy, So don't be too quick to judge persons, kasi talagang as a parent, please tell your children not to a lot of people lalo na yung mga illegal sellers ngayon, they make these synthetic drugs and put them into small candies, and then people pass them around not knowing po. Yun, not knowing.
Ako, Doktora, isa lang ang lesson na learn ko dito. There is a reason why your parents are called parents. There is a reason.
But talagang, I don't know, naging bata rin naman tayo eh. So, what can I tell you? But ngayon, yung pagiging pagkabata, parang mas dangerous na. Yun.
Yeah, okay. So, salamat. Ako, niliwanagan ako doon, Doktor. At least clear na an overdose.
This is not a judgment on anyone. This is a warning as a parent po talaga. Please, it's very scary po ngayon. Kasi yung synthetic drugs market is huge. Mukha nga mga vitamins pa nga yung iba eh.
If you Google it, nako, Doktora, some looks like gummy bears. Some look like gummy bears.
Mukhang gummy bear. Yun, nakakatak talaga sa bata po.
Totoo. Oh my God, I cannot imagine maswallow yun ng unsupervised child. My God.
You want You want a story? Ito, yung anak ni Jude Law, you Google this ha, parang ate something on the floor, which was like a drug or something like that, yung bata, and was rushed to the hospital. Yan, ano nga natin. I remember this, Jude Law child, Parang he picked up something about from the floor and ate something na hindi po dapat. Yun, and tinakbo po. Yan. So be careful po sa mga kids eating all sorts of things na nahanap lang po nila. Ito. Reyna, October 7, 2002. Jude Law toddler eats ecstasy.
I've heard of that. Nabasa ko yan. I was in practice during those years.
Ayun.
Yan, umikot sa amin yan.
Ayan, I remember like this. Ito po, the child was in a London club when she was picking up a children's birthday party in a club. And then, meron pong sinusubo sa kanyang bibig. Pagtingin po nila, ecstasy.
Yan po yung tinatawag na liquid G at saka liquid E, if it was mentioned somewhere else on the media. So, it looks like gummy bears talaga, Doc. It looks like gummy bears.
Talaga. Sorry, I really did not prepare for this, but this is what I know about drugs and high blood pressure talaga. It's possible. Lalo na yung mga ecstasy and things that we don't know about. Kami as doctors, we're flying blind in the ER because we don't know what you took. Yan. Okay? So, can taking drugs cause high blood pressure? Yes. Illegal drugs, let me read this. Illegal drugs can raise blood pressure by narrowing the arteries that supply blood to your heart. Yun yung sinabi ko sa cocaine. This increases your heart rate and damages your heart muscle. Ayan, amphetamines, including methamphetamine, shabu.
Yun. So, at least clean.
Ayan, luminaw ba? So,
yes,
yes, it can cause high blood pressure biglaan. Ngayon, if you are really someone with a weak aorta or any blood vessel po, pwedeng pumutok. If you are normally 90 and you become 180 within 1 hour po, puputok. May puputok. That's why people are rushed to the hospital.
Tapos ka pa, unconscious ka, hindi ka magising.
Akala nila tulog ka o what? By the time it happens, sige na.
Okay. Ay, nako. At least naliwanagan po tayo.
Naliwanagan na, oo.
Magandang knowledge to, Doctor. I didn't know that much or deep. Hindi ganun ka-deep yung knowledge ko when it comes to aortic.
Ako naman, I learned all of this by being on duty in an ER.
Okay.
In New York City, na kung ano talaga kinakain at inaano talaga ng mga tao doon. And I would like to tell you, Reina, na yung ER ko, kasi I worked in a very nice area in New York City. Super social na yung area ko, pero marami pa ring drug use. So can you imagine, kasi I was not really in the PGH of New York City. Yun yung sa mga Brooklyn, gano'n, tsaka sa mga upper Yung sa akin, ang ganda-ganda na ng part ng New York City, ang dami pa ring mga drug use akong nakita. Imagine pa sa mga ibang areas doon na talagang malala rin. Well, that's New York, di ba?
Yeah, that's New York. That's New York. And it's known naman eh.
So, no. Yan by being in the ER. Yun lang.
Oh no. Okay. Wow. Thank you so much. That's a wow, Doctora. From Miss Viva Nazareno. Doc, do you recommend anti-pneumonia and anti-flu in this time of pandemic?
Oo naman, you mean bakuna? Yes, if you have access, yes. Please do so.
From Miss Vilma Taruk, magandang gabi po, Doktora.
Ma'am Vilma, how are you? Good evening.
From Miss Oops, Mikey Shine Thompson, surgical mask today, just 6 hours wearing that, medyo nakakairita na.
Ay, naku ma'am. Magaling nyo nga na 6 hours kayo eh.
From Miss Rowena Mariano Lakad, hello, Doktora.
Ay, si Wen, kaibigan ko yan.
From Mr. Kim Christian Manabat, good evening, Doktora. Shout out from Tabuyok, Apalit, Pampanga. I'm always watching.
Sir Kim Christian, Happy New Year. Thank you.
From Miss Leonila Reyes, I'm always watching po, Doktora.
Thanks, Ma'am Leonila. Thank you so much.
From Miss SP Lopez Villegas, Doktora, share ko lang, nung na-CS ako last July, nahirapan po ako nung time ng operation dahil sa nakasalpak na oxygen sa akin. Tapos naka-face mask pa ako. Pinapatanggal ko po ang face mask dahil nahirapan ako huminga. Lalo, kaso naka-anesthesia na ako, di ko na ako maintindihan ng doktor. Haha, share ko lang po.
Ma'am, usually po talaga, ito lang sabihin ko talaga, lots of people po have different reactions to anesthesia. So, pwede po talagang nangyari po yan sa inyo. Meron pong undergo anesthesia and CS, parang walang nangyari. Meron naman po talagang nahihirapan. But it's possible po talaga na nangyari po yan sa inyo. It is possible. Kasi po, when we undergo anesthesia, we receive a lot of medications po para makatulog po tayo. Iba't iba po ang reaction ng bawat tao sa anesthesia. Some people parang walang nangyari. Yung iba naman talaga hirap. So, it's possible po. But I'm happy and I hope you're taking care of your baby. 6 months na po ngayon. Okay? It's possible. It's possible po talaga.
From Mr. Pino Kaliner Bree, hi Doc, here in SG kapag nag-jogging or cycling ka, no need to wear a mask kasi mahirap huminga. At 0 case na sila sa community ilang months na. Bakit sa atin mandatory talaga to wear a mask?
Ma'am, sir, kasi hindi naman ho tayo 0 cases eh. O kailangan talaga. Ngayon, pag araw na nag-0, is the Philippines gonna be 0? Parang sa akin hindi. Kasi talagang tingnan mo yung yung population density na lang po natin. Sa Singapore po, people are not packed into these small houses. Yung density po ng Metro Manila is a megalopolis po talaga. So, I think for the safety of everybody, wala talaga tayong choice eh. And in fairness to Singapore, nagkalat ang dyan sa mga dormitoryo po ng mga ng mga foreign workers. So, density. What's the meaning of density? Crowdedness. Yun po yun. Sana we will reach that point in Singapore. I'm praying and praying po talaga. But parang wala eh. Malaki talaga ang Pilipinas compared to Singapore. Saka syempre, sorry, may mga pasaway dito. Sorry talaga.
From Mr. June M. Todino, good afternoon po, Doc.
Sir, Happy New Year.
From Mr. Jack, hello po, Doktora.
Jack, kumusta ka?
From Miss Elma Villapando, heart.
Heart. I like that.
From Miss Mercedita Pareha, good evening po.
Ma'am, magandang gabi po.
From Mr. Edwin Buwita, good evening, Doktora.
Kumpare ko yan. It's a long time siguro. Normally kasi dati, nung pandemic, si Sir, mahilig mag-comment at saka manood. Tapos, I think he went back to work. Kasi working time. So, talaga hindi siya nakapanood. Ngayon naman, medyo, I'm sure, tapos na yung office ni Sir. May kumpare. So, he can now watch us. Oo.
From Miss Beth Taro, good evening po.
Ma'am Beth, how are you?
From Miss Leia Peña, good eve po, Doktora.
Hi, Leia. Kumusta?
From Miss Sheena Faineri, good evening po, Doktora.
Ma'am, kailan ka? We're waiting for Ma'am to come back from Davao to work again with us.
Yahoo! From Mr. Joel Castellano, Doktora, welder po ako. Ano po ba okay lang po ba maligo pagdating ng bahay?
He is a welder. Sir, parang as a welder po, you wear a welding mask. And then, mainit din po. And then, ang advice ko sa'yo, wait ka muna. Bago ka maligo. Some people put rubbing alcohol po para, ma-relax.
From Miss Alatoha Musni, is there a possibility of zombie Sorry, sir, natawa ako. Possibility of zombie apocalypse po, Doktora Ana York Bondok. I don't think if this makes sense. Hehehe. Magandang tanong.
I like that. Para tayong train to Busan. Dapat kayo mag-usap ng anak ko. He watched Sweet Home. It's a zombie movie. Nanood po si Ito ang nakakatawa, no? Yung anak ko came home after hanging out with his pinsan. And mysteriously, yung anak ko po, he's 8. He normally sleeps at 8:30 po ng gabi. Nandun na ho sa bed. So, nung mga 1 week ago, 11 na, nandito pa niya. Parang he was following me around the house. Malit lang po yung bahay namin. We have only 1 bedroom and 1 CR. So this child was following me around. Parang ayaw niya matulog, Reyna. Then parang pretending to watch his iPad, ganun. Basta hindi daw siya sleepy. Yung tatay niya tulog na. So finally, natulog po yan ng alas 12, nakakapit sa akin. Nakala ko naglalambing. In the morning, he told me that he watched Sweet Home, which was a zombie apocalypse movie. So, sabi ko nga sa tatay niya, there's one reason why Benji did not sleep last night. Sabi ni daddy niya, ano yun? Sabi ko, horror movie. Tawa ng tawa yung tatay niya. So, pag nagkaroon po na zombie apocalypse, dalawa po kayo ni Benji, you will defend us, sir. And he plans to shoot down all zombies. Mahilig po sa zombie apocalypse yung anak ko. Ako naman, nanood ako ng Train to Busan. Yun lang. Opo. But I like that question.
We'll never know, di ba? Hindi natin
masaya. Just go.
Oh my God.
In case of a zombie apocalypse, we need guns. Oy, no comment on what's happening in America. Ibang klase yun.
What's that? I didn't know that.
Ay,
Doctor.
nako, no comment. Basta na lang kayo. I don't wanna go into politics. Health lang po tayo rito.
Okay.
Basahin
I thought
nyo na
it
lang.
was the one in Texas. Yung
Basahin nyo na lang, okay?
From Miss Elma Villapando, Doktora, lahat po ba ng nawawala ng panlasa at pang-amoy ay siguradong COVID?
Ma'am, hindi. Because there are people po nawawala ng panlasa and paninom from flu and the common cold. Pero hindi siya talaga masyadong Sometimes po, pag mataas ang lagnat mo, there's a situation na naiiba yung panlasa. So, iba pa rin po yun sa nawawala ng panlasa. But ma'am, yes, if you're feeling bad, mataas ang lagnat nyo, nawalan po kayo ng panlasa at pangamoy, I would say you would have COVID, almost 90%.
Okay.
Like for example, mataas ang lagnat mo, then inuubo ka, then nawalan ka ng panlasa and pangamoy, I would say you have COVID instead of thinking of dengue or other reasons for fever.
All right. Oh, no.
But talagang papaswab muna kita, ma'am, kung sakali. Or yung pasyente. Not necessarily kayo, yung pasyente. Opo.
Yung pagka nawalan din po ng panlasa at saka ng pangamoy, ang dami ko na nababasa, Dok. Ano na sila? Parang one that I read is that the doctor told him na yung neurons for pang-amoy namatay. Yun yung last time na lecture natin.
I explained that already. That's not actually true. Ang naapektuhan po were the supporting neurons. It's not the neuron itself. It's not the nerve. It's not the olfactory nerve. It is the supporting cells for the olfactory nerves. They have a lot po of this what we call ACE receptors. Doon po pumapasok yung COVID. So, pumapasok po sila into the supporting cells, not necessarily the neuron itself.
Yes, please clarify that po, Doktora. And that's causing
that. And I got this straight from a neurologist. And then I think I had a topic on nawala ng panlasa and pangamoy.
Yes, please.
And then yun po yun. It's the neurons. Opo. It's not the neurons. It's the supporting cells of the neurons.
The A receptors particularly.
May ACE receptors. ACE.
Okay. All right. So, next po. From Miss Agnes Canivel Lalu. Hi po, Doktora. Good evening
Agnes, magandang gabi.
From Miss Jesusa Lara Reyotica. Thank you po for your answer because here in Dubai, they started to receive vaccines which is free for everybody. There are choices po between Pfizer and Sinopharm.
Ang swerte naman nila. Okay kayo, ma'am. I'm glad. Both naman po, pag-usapan niyo po what's best for you. There's a lot of data on Pfizer, that I would say.
From Miss Dina Gonzaga. Hi, Doc. Watching from Bacoor.
Thanks, ma'am. Kumusta kayo sa Bacoor?
From Mr. Justin Yumol. kay Kawanted. Good evening, Doc Ana from Macabebe, Pampanga. Happy New Year and God bless.
Ay, kababayan ko yan. Good evening, Happy New Year, and thank you for watching us.
From Miss Flordeline Garcia Torres Mencias. Hi, Doc Ana. Good evening. May I know your take about on handling the grocery items when you get home? Thank you.
Ma'am, in the beginning, talagang everybody po was so scared to handle grocery items. Yung pinsan ko ho, talaga ina-alcohol talaga niya isa-isa yan. But as the pandemic went on po, we learned more and more things po about COVID. And yes, COVID can survive on surfaces po for up to 72 hours eh. Pero ma'am, talagang rare na po. Wala pa naman po talagang taong na-COVID from a grocery item. Marami po talagang na-COVID because they removed their mask or they ate po talaga. Or they attended a gathering. So, ang advice ko po sa inyo, kung talaga pong lalabas kayo, wear a mask, buy your grocery items. Kung talaga nininervous po kayo, punasan nyo na alcohol. Wala naman pong masama. Nothing wrong. They're just being cautious. Kung ano naman ho, some people po, they leave it out for 48 hours kasi after 48 hours, patay na ho lahat ng COVID. Basta yung mga ice cream, ilagay lang ho sa ref, ano? Kasi syempre sa freezer, kasi bibigay po yun. So, if you want to wash a grocery item or i-alcohol niyo po, there's nothing wrong. If you want to leave it for 48 hours, there's nothing wrong. And if you feel like using your grocery item naman po kaagad, likely naman po, wala naman po. But as long as when you went out to the palengke or to the grocery, you were wearing a mask. Yun po yun.
From Miss Laling Taguco. Hi, Doc. Watching from Iligan City.
Wow, galing pala sa Iligan si Ma'am. I did not realize that. Sometimes, di ba si Ma'am makes comments and greets us. Thank you, Ma'am, letting us know that you are from Iligan. I did not realize that.
From Miss Cindy Abinas Cantillo. Hello po. Gandang hapon po, Dr. Ana. Good to watch and hear good insights again. Must watch talaga. Thank you po.
Wow, thanks, Cindy. Thank you so much for that kind comment. Thank you so much.
From Miss Zari Cruz, Larin. Magandang gabi po.
Nako, na-miss natin si Zari. Next time talaga i-message ko yan pag may ask Dr. Ana.
From Miss Annalie Cañete Boreto. Good evening po, Doctor.
Ma'am Annalie, how are you? Thank you for greeting us. Good evening din po.
From Miss Raymond Alan Sese, Doktora, na-feature niyo na po ba yung topic about acute glomerulonephritis sa mga previous videos? Thank you.
Sir, wala pa. But one of my best friends is a nephrologist. Let me harass Dr. Dolik Nang. Opo.
From Mr. Coral Jr. Rodolfo, Dr. Ana, gandang hapon po.
Sir, one of our frequent viewers, it's an honor, sir.
From Miss Elma Villapando, praise God for the wisdom and knowledge that you are sharing. God bless you more.
Ma'am, you know what? Yung situation po namin, it's not a one-way I actually like this lots of people keep giving health tips. Parang one way yung direction eh. Ma'am, I'm also, if you're learning from me, I'm learning from you. Ganun po yun. Kasi marami rin pong, people think that doctors are parang giving informations to persons. But yung interaction po natin is a learning for me. And sometimes you ask questions po na napapaisip din ako eh. Opo.
From Miss Barbie Taruk Olap, maraming salamat po, Doktora, sa pagsagot mo ng tanong ko. God bless po and more power.
Thanks, Ma'am Barbie. Don't hesitate to ask po.
Ayan na po ang tanong ni Miss Zari.
Ayan naman, Miss Zari. Okay, go.
From Miss Zari Cruz Larin, ano pong tips ang maibibigay nyo sa taong nais o gustong mag-diet?
Nako, Diyos ko. Wala. Kasi ako yung number one doon. Ako po sa tanda ko to. And sa dami na po ng diet na nalaman ko, it's not the diet eh. I mean, every diet you lose weight eh. But you have to have a goal. You have to know why you're doing it. And I would suggest po talaga it should be for health reasons. Yung sa beauty reasons po, parang, yun eh, hindi ka magtatagal. You have to appreciate why. And then number 2, you have to find the diet that works for you. Some people po, They just don't eat rice. Yung iba naman po, ako po, I tend to go on to vegetable and fruit. Yung Scarsdale, I like that. Meron naman po talagang, some people go on a high protein. Meron naman intermittent fasting. Studies have shown po that most diets, you will lose weight. Ang problema talaga yung maintaining your weight loss, Reina. So what I would suggest is you do a diet, but you have to choose to change your lifestyle. Ganun talaga. And you have to change it in a way na kaya mong i-maintain. Kasi yung, ay, wala akong kakainin forever and ever, yung pala, is that realistic? So parang ganon, you also have to give yourself some leeway na magkakamali ka, nakakain ka rin, and then have the willpower to come back. Yun lang po. And it also depends po on you. Kasi some people, some diets work better for other people than others. And then, another thing that I would like to emphasize, Arena, and people don't, I learned this in residency. Healthy eating starts from pamamalengke. Kasi kung healthy yung pamamalengke mo, or yung pag-grocery mo, hindi mo makakain dahil wala sa loob ng bahay mo eh. Do you get it? Samantalang if you went grocery shopping, and you bought all this stuff, wala mangyayari kasi nandun na sa loob ng bahay mo. So actually sa US, when we counsel people on diets and food, we start from a healthy marketing or healthy grocery. It does not start from don't eat like that. Kailangan yung binili mo angkop dun sa plano mo.
Napakagandang health tip.
Talagang yun, na tinuruan kami noon na it's even in the way you cook. First of all, it's in the way you market. Okay? What did you bring into the house? Number 2, how do you cook? Ikaw ba ay nagpiprito? Ikaw ba ay nag-iihaw? Ikaw ba gumagawa ng soups? Ikaw ba, do you get it? If majority of your cooking is prito, and then only then can you move on to ano ang kinakain mo.
Okay, from Mizari Cruz Larin again. Kapag po ba madalas pulikatin, ano po ang mga dapat gawin?
One of the things that I like po sa mga napupulikat is sometimes po we lack certain minerals. I try to ask them po to improve their diet. Number 2 po is to sometimes yung drink, yung mga Gatorade, kung minsan po meron tayong minerals na kulang. I would try that. And also to improve your diet.
Okay, from Miss Joel Castellano. Doc, from Santa Tomas, Pampanga po kami. Yung anak ko po may rheumatic heart disease. Po siya every 21 days, injection na ng Pen-G for 5 years. After po ba nun mawawala na?
Alam mo, sir, this is a beautiful question. And what you're talking about is, wait lang I think ASD, wait lang rheumatic heart. I'm not a pediatrician po kasi or a cardiologist eh. Ayan. Opo. How old po yung nyo? Yung nyo? How old is your child? Yan. Ito po this is normally a pediatric issue and a cardiology issue. Hindi po ako pediatrician or cardiologist. But what I know po talaga, ang rheumatic heart disease po, talagang nung unang panahon, a lot of people got rheumatic heart disease. And what is rheumatic heart disease? It's called rheumatic fever. Tapos po, yung streptococcal bacteria, kinakain po yung mga valves po ng ating kinakain po yung mga heart valves. You get you get po valvular problems from rheumatic heart. Noong unang panahon po, people used to get a lot of rheumatic heart. And that's why when you have sore throat po, people usually start kaagad penicillin para hindi na po bumaba. In fact, one of my best friends po from elementary school had rheumatic heart. But it's going away na po. I cannot really answer that question po. Siguro let's have a cardiologist join us or a pediatrician. Kasi po, I'm an adult pulmonologist. My specialty is cancer. But thank you for that question. Pag meron po tayong pediatric cardiologist, again, my classmate is one of the best pediatric cardiologists po sa Pilipinas. Dr. Leah Arceo, let me invite her nga po and let me fully answer po that question. Rheumatic heart is something that is not very much seen anymore. Nung unang panahon po talaga. And how to avoid rheumatic heart, the moment you get sore throat, a lot of people immediately give po a lot of people immediately give treatment para po hindi na po, kasi baka ho bumaba dun sa heart valves, and that is rheumatic heart. Opo.
Okay. Next po.
I will guess the cardiologist for a better understanding po of that question.
Yes, please. From Miss Jocelyn David Terine. Good evening po.
Jocelyn, good evening.
From Mr. Direct Ron Di Makili. Watching po here at our chocolate store. Hi po, Doc. Happy New Year to all. More blessing and keep safe po.
There is a chocolate store. Saan yan? Gusto ko yan. There goes the diet. Ayan, goodbye na diet, Miss Zari. Narinig ko lang yung chocolate store, bumakting ang tenga ko.
From Miss Rhoda Acevedo, hi doctor, tanong ko lang, ano pwede ko inumin na mamalihid legs and fingers ko? Thanks, doctor.
Ma'am, sa ganon, question, are you diabetic? Marami po talaga. That might be the first signs po of diabetes. Check it out. Kasi po yung mga namamanhid na toes and fingers, extremities, very common. That is what we call peripheral neuropathy. Okay, what is the meaning of peripheral? Ends. Central yung opposite. Peripheral yung sa dulo. That means toes and fingers. Neuropathy, yung iba-iba po yung nararamdaman nyo sa inyong kamay at paa. Usually po, very common sa diabetics. Ang ano po doon, traditionally, people give B1, B6, B12, yung B complex. But I would also check, if you are diabetic, I would check my sugar.
From Mr. Direct Ron Di Makili, Alive, it's a zombie film. Nice movie also. Hehehe, just only saying po. Ayan, Benji, you have to watch Alive.
Alam mo, yung anak ko mahilig sa mga zombie.
From Mizari.
Napanood niyo ata yung Alive. Oo, napanood niyo yan.
From Mizari Cruz Larin, ang pagsinok po ba ng walang hinto ay sintomas ng COVID? Magandang tanong yan, ha?
Ang pagsinok po ng walang hinto, I would say no. Ito lang ang sasabihin ko, ang pagsinok po is it's the muscle of the diaphragm. So, it can be a rare symptom of cardiac, it can be a rare symptom, hiccups po and cardiac or stroke ba yun? And heart disease. Ma'am, it's not related to okay. Heart attack, hiccups or pagsinok po is not related to COVID, okay? At least as far as I know, I don't. There's no relationship to COVID, okay? But I would like to read this. Hiccups that refuse to subside, lalo na po kung may edad na po yung tao, lalaki, overweight, high blood, diabetic, okay? Persistent or intractable hiccups can be a sign of inflammation around the heart or a pending heart attack. Kasi po, this is our heart. The diaphragm is here. Naiirita po si diaphragm. So, sinok kayo ng sinok. I learned that also in New York City. Kasi we work po for one of the largest cardiology, kilala po yung hospital namin for cardiac surgery. So, I remember my boss always telling me, kung merong persistently sinisinok, yung mga obvious signs of cardiac disease, lalaki, over 55, high blood, diabetic, taas ang presyon, kumakain ng taba ng baboy, imbestigahin mo yung puso. Okay?
From Miss Elena Larin II, kamag-anak kaya po ito ni Miss Larry?
Oo.
Okay, good evening po. Tanong ko lang po, normal lang po ba sa isang tao at middle age yung pagiging makakalimutin? Thanks po.
Ilista mo na ako dun, ma'am. Oh my
Oh
God.
my God. Next na din ba ako, doktora?
Wag naman, bata pa kayo. It's
Doc,
possible,
I
ma'am,
have
no?
to,
Pero it's possible yung mga mild, pero pag iba na ho talaga, there is such a thing called premature dementia or early onset po. So, I hope kung mild lang po, it's okay. How to avoid po pagiging magiging and how to train your mind. You can continue to do crossword puzzles, read, keep your mind active po so that you're really forced to think.
I have a question, Doc.
And it's not related to CS. Alam ko napakaraming magtatanong.
Yun ang tatanungin ko.
Ayan na nga ba? Lahat ng mga nanay keep asking that. I think it's due to stress.
Really? Pero parang sinasabi
Oo
na,
nga, mom. You think of so many things eh.
I think yung, post CS na, Doc. Like after,
It's not related to the CS, I promise you. Bakit pa dami-dami nagtatanong niya?
Sabi kasi nila yung mga anesthesia daw.
Papunta ka pa lang, pabalik na ako eh.
Na tinurok daw
All these moms keep asking me, no, it's not related to the, babang yung tatanong, ma'am, lahat mo na anesthesia, naging malikalimutin. No, talagang wala naman ho talagang studies na gano'n.
Okay, at least malinaw.
We just to blame our OR, and the most common OR talaga sa mga ladies is CS, so gano'n. Pero wala namang appendicitis naging walang gano'n.
Oh no.
Pero I don't know, talaga nakalink siya. I think it's more of due to the stress of being a new mom. That's what I mean.
Pero 'di ba, there is natatandaan ko to nung buntis ako, always sinasabi to ng OB ko, yung nagiging makakalimutin ng mga buntis, like makakalimutan mo yung susi ng kotse mo sa loob ng ref. Yun.
Hindi naman. I wouldn't say. I think, being and then being busy with your kids is a very stressful time. So that's what I would put it more to stress than actually being related to being pregnant. Okay?
Oh no, ganun na ba?
I would put it more to stress. Ganon.
Okay.
Wala naman kasi talagang connection yung matris mo tsaka yung utak mo eh. More of the stress.
Kasi because of the anesthesia that talaga. Okay.
It's just a common misconception. Oo.
Alam niyo na po
common misconception. Oo.
Okay, from Mr. Direct Ron Di Macali. Doc, ano po ang best way to do or gamot sa mga acidic po? Tama po ba tawag doon?
Sa mga acidic po, as I mentioned earlier, thank you, sir. Kayo po ba yung nasa chocolate shop na gutom? Sorry, hindi ko talaga makalimutan yung chocolate shop. Ganito po yon. If people who are acidic, they usually feel a burning dito po sa throat. My mom was very acidic talaga. Talagang na-feel po nila yung kaasiman eh. Ito mga, as I mentioned before po, talagang it's a matter of changing your diet. Avoid soft drinks, avoid po talaga yung mga spicy foods, avoid po citrus, avoid coffee, and try to eat po talaga 2 hours before you go to sleep because yung gravity po talaga, when you lie down, bumabalik po talaga, yung lang talagang isipin mo yun, your stomach is level with your chest, so talaga aakyat siya. So, yun po yun. Some people, inaangat talaga yung ulo nila para ganun po. It's more of avoidance. And talagang, if talagang hindi po mawala, maybe you have to do endoscopy. Kasi po, meron po talagang H. pylori, yung there's a bacteria po talaga that causes ulcers.
Okay. From Miss Adeline Samolde, good evening, Doc. Watching from Taguig City. Thanks sa mga info po. Very helpful po.
Thanks, ma'am. Kumusta sa Taguig?
From Miss Christy M. Rosel, Happy New Year po, Doktora. Watching from Balayan, Batangas. God bless.
Wow. Thanks, ma'am. Apo, thank you.
From Miss Rosario Maglake, magandang gabi, Doktora Ana. Watching from Balanga City, Bataan.
Wow. Balanga, Bataan. Yan.
From Mr. Direct Ron Di Macali, ano po cause ng bakit laging binabangungot po?
Sir, hindi pwede, di ba you only get bangungot once and then you die?
Baka ang ibig sabihin niya, Doc, yung lagi siyang nananaginip ng hindi maganda. Mag-isip
Yeah, I mean, sorry iba kasi yung ano yung ano natin ng bangungot. Ang ano ko kasi po talaga, ito I would like to tell this to you guys. I had the opportunity, kasi I almost became a pathologist. What is a pathologist? A pathologist po, yun po yung gumagawa ng autopsy. So binubuksan po talaga namin yung patay at tinitingnan po namin kung ano po yung kinamatayan po nila, no? So these are the jobs of pathologists. Pathologist. Paki-search na lang Miss Kat and please type it a pathologist, okay? So, ano po I had the opportunity to autopsy. Oh, nag-autopsy ako, Reyna, ha? I was the number 2, kasama ko po yung main pathologist. We autopsied somebody who suddenly died sa rumored na binangungot. So pina-autopsy sa amin kasi talaga hindi ho matanggap nung pamilya yung nabangungot po yung tao. And you know what we found out nga, yung acute pancreatitis. In fact, I was the main discussant in the Department of Surgery discussing acute pancreatitis. Parang presenting as bangungot. Ganon. Parang pagpasok po ng tao, sinabi nilang nabangungot, pagbuka po namin, acute pancreatitis. What is that? Yung ano pamamaga po ng pancreas. Where is the pancreas? The pancreas po is the one that produces insulin po sa katawan natin eh. So, yun po yun. It's in the abdomen. Opo. And nakaano po siya somewhere, nakaganon with the tail of the pancreas. Okay? So, what is your definition of bangungot? If your definition of bangungot is yung binangungot, that's only happening once and hindi na po mauulit. If your definition of bangungot is bad dreams, what causes bad dreams and the science of sleeping, Um, stress, pag-isipan niyo po. Also watching all these zombie movies before you sleep and you end up like Benji. Okay?
Sa
Yung mga
psychology,
nanonood ng Alive,
yeah,
Sweet
psychology.
Home, lahat yan, bago matulog, bad dreams po talaga mangyayari sa inyo. If you're talking about bad dreams, I would suggest relaxation and meditation po before you sleep. And you try to think, is there something bothering you? Kung minsan po talaga, it comes out po in the way we sleep. Yun po yun.
That's true. Yung sa psychology, it explains sometimes yung dreams natin are linked to your subconscious and
Yun na
unconscious.
nga. Sometimes it could be that that you might be bothered by something. Opo.
Yeah.
Try to examine po. Opo.
Essential oils can help you sleep better.
Kung gusto niyo ho ng Young Living, Miss Reyna, maiyan po. Commercial break.
Lavender can really help you sleep soundly, okay? All right.
Okay.
Let's move on to Miss. I think there's another
Parang may flash ata si Ma'am. Opo.
Zari
Ma'am
Cruz.
Zari. Zari.
Hindi na po ako nakakanood ng live. Wala pong signal ngayon lang po ulit pa. Wala pa po.
Ma'am, we post everything on YouTube and then pinopost din po namin dito. But ma'am, if you send your questions in advance, we'll answer them naman, Ma'am Zari. Ikaw pa.
Miss from Triple S siblings. Sorry, Doktora. Maya Pabengi, Doktora. Natural method to cure acid reflux from San Juan, San Luis, Pampanga, but working here in SG. Shout out to Peña family.
Hi to the Peña family. Keep safe po dyan sa SG. Yung acidic po, I try to avoid. Yung bang avoidance sa akin is a very natural therapy. Parang i-avoid mo na lang yung alam mo mag-aasido sa iyo. Yun.
That's right. Prevention, Doktora?
Prevention is good.
From Zari Cruz, Larin, sana po may imbitahan rin po kayong dermatologist. May mga katanungan po ako. Salamat po sa pagsagot
Ay,
sa
Ma'am. Yes, thank you, Ma'am Zari. Yes, I don't know anything about the skin, honestly. Don't even ask, okay? Siguro acne kaya ko, pero wala po talaga akong alam sa we need a derma. Opo.
From Miss Sarah, she sent some smileys, Doktora.
Smileys to Miss Sarah.
From Miss Corazon Rafanan Espejo, Happy New Year po, Doktora. Good evening.
Hi, Ma'am Corazon, how are you and good evening?
From Miss Jessie Guevara Lagman, Maya Pabengi po, Doktora Ana York Bondok. More power po.
Sir Maya Pabengi po, kumusta kayo and more power?
From Miss Rosalinda Chico Abello, good evening po, Dr. Ana York Bondok. Salamat po sa mga info. Marami po kaming natututunan.
Thanks, ma'am. Nice to hear that.
From Miss Belma Suwobiron talaga. Thanks for the info on acidity.
Ma'am, marami talaga may problema niyan. Oh. Actually, let's hunt down Dr. June Ruiz and force him to give us an acidity.
Yes, magaling, magaling.
Magaling si Dr. June.
Yes, I can say. Okay, from Mr. Direct Ron Di Macali. Thank you po, Doc. Bangungot po na di makagalaw po. Sleep paralysis. Ang tinatanong niya, Doc.
Oo. Sir, try to relax po before you sleep. That might help you.
Doc, naranasan mo na yun, yung sleep paralysis?
Maraming ganyan na. I'm not a sleep expert, though I know someone who is a sleep expert. A very good friend, pool mo rin eh. Ako hindi, I think it happened to me twice in my life. And I would have to say, Reina, that I was very exhausted during that time.
I know, Doktora, I could add to that testimony also, no. It happened din sa akin maraming beses, and this was the time na I was in my peak of anxiety and depression. So, maganda talaga. Tama yung
sinasabi. Mental health talaga is
yes.
Big component of that.
Pero nakakatakot yung sleep paralysis, no, Doc?
Oh, well, ito naman masabi ko sa iyo, Reina. One time, I fell asleep in the shower. I was reviewing for an board exam. Sobra na talaga akong pagod. Now, I woke up, I took a shower to sort of wake myself up. I was so tired, I fell asleep. And I really fell. So, it can be quite dangerous. I don't know if it's sleep paralysis, but maybe overtired. And then, one time naman, I was heard shouting, pumila po kayo, pumila po kayo. Isa-isa lang po, pumila po kayo. So, nagpanic ho yung kasambahay namin. That's why was I shouting. Then when I woke up, she asked me, Doktora, why were you shouting, pumila po kayo? It turned out I was on duty in the Pedia ER and I was shouting to everybody the whole day, pumila po kayo. Alam mo naman ang PGH, no? Talaga kailangan pumila. So, sometimes really, the stresses that we're feeling might come out in the way we sleep. Yun lang.
Yes. Oh no. Oh no. Sige, invite tayo, Doktora, ng sleep expert.
Sleep expert, ang ganda siguro niyan, ano? I have 2 classmates na sleep experts.
Mukhang madami ang hindi masyadong makatulog ng maayos ngayon. Sige, Doktora, let's
Di ba blockbuster yung How to Sleep Well?
Yes, last year. We have a talk.
Di ba blockbuster talaga yun?
From Mr. Jerome Bartolome Ambao. Hello po, Doktora. Watching from San Luis, Cabalen.
Cabalen. Opo. Thanks, sir.
From Miss Bebs Galman. Happy New Year, Doc.
Ma'am Beth, how are you?
From Mr. Jerome Bartolome Ambao. God bless po and more power to you, Doktora. Happy farming. Stay safe.
Wow, ang saya naman. Happy farming din po.
From Miss Cindy Abinas Cantilo. Ano po ba ang GERD? Ito ba ay related to ulcer or acid reflux?
Gastroesophageal reflux disease. Related po yan sa acid reflux.
Let's invite Doc June, Doktora.
Let's force Doc June. Let's not invite him.
From Miss Flordeline Garcia Torres Menchas. Thank you, Doktora, for sharing your medical point of view to all of us. God bless you more.
Thank you, ma'am.
From Mr. Direct Ron Di Macali. 3 times or 4 times mangyayari po in one night po. Oh my God, thank you po. Yung sleep paralysis.
Pa-check muna kayo. Maybe, ito lang before we go into one's emotional state, I would suggest rin po na have a thorough physical checkup.
Yes. Kasi kung gano'n nakadalas, no, Doc? Baka
Ayan. And then try relaxation techniques, sir. Mag-meditation kayo bago kayo matulog.
Sir, PM mo ako. I'll get you some lavenders. I-diffuse mo yun.
Pwede rin.
Yes. Okay. From Mr. Director on Di Macali. Thank you po. Nice po. Yes po. For sleep expert po. Yan. Tara, Doc. Paano tayo ng sleep expert? From Miss Eugenia Nebrida. Hello po, Doktora. Avid fan mo po ako simula na mapanood kita sa DZRH kay Anthony Taverna. Simula po noon, hinanap po kita sa Facebook. Facebook po ako sa napaliwanag mo. From Malolos po ako, God bless po.
Thanks,
po.
Ma'am. Opo. Ang ganda naman ang sinabi ni Ma'am. Thank you so much po.
Asa na siya? Wait lang. Meron pa po siyang follow-up from Miss Eugenia Nebrida. Thank you po, Doktora. Napakaliwanag mo pong magsalita.
Alam mo kasi, Ma'am, ito lang a lot of doctors are fabulous. They're really good. Sometimes talaga, kasi they're so good, parang hindi nila malagay yung sarili nila into the pwesto of someone who actually knows nothing. And that is a skill. Communication is a skill. Opo. And ako, because my other job is a politician, so sanay po ako to talk to presidents, and I'm also sanay to talk to barangay tanods and just anyone na in the barangay. And what I could see po is that there's not a big difference between these people. It's just the way po that we explain, opo. And talaga kailangan ho talaga, what's the use of a fabulous doctor kung hindi niyo po ma-explica yung problema po ng tao? Kailangan po, pag alis ng tao sa inyo, naintindihan niya kung bakit siya nagkasakit, kung ano po ang kailangan niyan dapat gawin. Pag hindi kayo nagkatugma doon, sayang po yung binayad sa inyo ng tao. You wasted your time, he wasted his time. So what I could say po is really we have to explain po medical terms, and we have to put ourselves in the place of the person who is listening for the first time. Gusto mo yung kwento ni FG, and it doesn't really matter how intelligent you are or what is your position in life. So binisita ko po si FG kasi 'di ba we're talking about the aneurysm. So binisita ko po si Sir FG sa ICU. Because I'm a doctor and a very good friend of Kong Mikey, pinapasok po ako. When I got there po, I'm an ICU physician. So when I got there po, inabot ko po si Chief of Staff at saka si PNP. I cannot remember who they were, but talagang they were left speechless staring at FG. They were so scared. So what I'm trying to say is, our station in life doesn't matter, but yung concern po natin sa ating health, and when we don't know something, natatakot po tayo, and we really rely on doctors to tell us po what's going on. So yun po yun. And I hope really, kasi sometimes, if you don't understand po, you cannot follow the doctor kahit gusto nyo po eh. Kasi hindi nyo maintindihan eh. So I'm hoping to bridge the gap. And lalo na ngayon na may panahon ng COVID, ang daming tinatapon na medical information ng mga doktor, not realizing that the persons that they're talking to are lay persons. Naku mo yun, Reyna. You're suddenly supposed to understand antigen test, antibody testing, swab testing, PCR. Ang hirap ng mga terms na to, my gosh. And then, but because of what's going on, we need to learn it. So, I'm really interested po in the way the normal person understands science and how we can help them to better their life. Yun. Kasi, at dito yung doktor, supposedly, andito po yung mga pasyente, hindi sila nagaganyanan eh.
From Miss Eugenia Nebrida again, mabuhay po kayo, idol. Galing, yes po, doktora.
Wow.
That's all that we have for tonight,
Okay.
Doctor. Wow, what a run.
2 hours, kailangan talaga siguro we should do ask Dr. Ana regularly kasi ang dami talagang may tanong eh.
Oo, Doc. This is a very good run, Doktora. Napakaganda ng episode natin na to ngayon. Ang dami nating na-discuss.
Parang, we discussed COVID, kung ano-ano pa, mga
aneurysm.
All sorts of other questions na talagang things that we're seeking to understand without judging others. Hindi po tayo nag-judge ng ibang tao. We just really want to know, ano ba pinag-uusapan ng mga to? Ganon. Opo.
Yes.
And then how we can be cautious, advise our children, laganap po ang drug overdose talaga ngayon.
Yeah, Doktora, gusto ko lang idagdag doon sa sinabi mo, no? Kaya din naman napatanong ako kanina is that for everybody's education, kasi number one, kawawa yung mga taong ginajudge natin, binabash natin online. We really don't know what's happening. Maganda na may mag-seek tayo ng explanation. Ito, very medical yung term nung na ginamit. magtanong kayo sa amin. Kaya nga kami may Ask Doktora Ana. So, tanungin nyo before kayo
Kasi people are
mag-contribute.
just tossing out medical terms expecting everybody to understand them. Hindi po gano'n. It's not automatic. Opo.
Yes, oo. So, pwede kayong magtanong. We invite you guys to join us every week for Ask Doktora Ana. Oh, Doc, may mga nagpahabol. Okay,
Oh my
from
God. Oh.
Rondi Macali. Love, Doc. Naku, mukhang
Wow
bagong
naman, love din, sir. Balikan nyo kami. Update us on your problem, okay?
Yes. And
Okay.
from Miss Aling Tago ko, Doc, magandang gabi po. Yung acid reflux po ba ay cause din ng shortness of breath po?
It can happen. Ma'am, it can happen. It can happen. It's possible. Nakita ko na yan.
From Mr. Gabo Bathan Villapando. Thank you po, Doktora. Salamat po kasi madami pong natutunan mama ko sa inyo. Elma Villapando. God bless po.
Hi, Mommy Elma. Thank you for watching. And thank you also for greeting your mom. Oh, shout out to mom.
From Mizari Cruz Larin. Sobrang sang-ayon po ako na maganda ang pagpapaliwanag mo. Doc.
Wow, thanks. Thanks, Ma'am Zari. Thank you so much.
That's
Okay, so
all.
to everyone, dinner na. Diyos ko, magsa-7 na. Okay, guys? Ingat. Thank you.